Hello everyone, I am Dr. Tanvi Mahant and welcome back to my channel HomeoHeals. So in today's video, we are going to talk about what are the complications of PCOS or what we call as Polycystic Ovarian Syndrome. So PCOS cases are increasing day by day. Every other day I see some female suffering from PCOS and the age group is decreasing. Even in early 20s and late teens I've seen girls suffering from PCOS. So first let's understand when we diagnose that a female is suffering from PCOS. So we look for three criteria. So the first one is hyperandrogenism, that is increase in androgen level, which is a male hormone. The second is if there is menstrual irregularities, that means irregular menses or there is disturbance in ovulation. And the third is on the sonography if we see there are polycystic ovaries. Alright, so even if there is two criteria which is present out of this three, we say that the female is suffering from PCOS. Now let's understand what are the complications of PCOS. So the most common is infertility. So many couples are struggling with infertility and PCOS is one of the main reason in females leading to this. Now why does this happen? Now we mentioned that there are menstrual irregularities and ovulatory cycles. Okay, that means the ovulation which should happen every month, that is the egg release from the ovaries, is not happening in PCOS cases because of severe hormonal disturbance, decrease in female hormone, increase in male hormone. So for the ovulation to happen, the follicles which are present in the ovary should mature and reach a particular size. But in polycystic ovaries, there are multiple immature follicles which are present, but none of it reaches to a size for the ovulation to happen. And because of ovulatory dysregulation or dysfunction, infertility is one of the major complications in PCOS. The second complication is insulin resistance. Now insulin resistance, which is because of obesity or abdominal obesity in females. So if you see the waist circumference in females is more than 88 centimeters, the waist hip ratio is more, and this obesity is slowly causing insulin resistance, which we clinically can see in the form of hyperpigmentation in the neck area, in the axilla, which we called as acanthosis nigricans. And if this insulin resistance is not addressed, okay, not treated, not managed, later on after years it can also progress to type 2 diabetes mellitus. Right, so this is another dreaded complication of PCOS, that is type 2 diabetes mellitus. Now let's understand this a little bit. So whenever we eat our food, okay, the glucose increases in blood, and the moment the glucose increases in blood, what happens? The insulin is also released from the pancreas. This glucose binds with the insulin and it is removed from the blood and it goes into the cell. Right, but what happens in insulin resistance is the glucose is high, the insulin is high, but this glucose doesn't bind with this insulin. So that is why in PCOS cases we see the insulin levels are also high, the glucose levels are also high, what we call as hyper glucose state and hyperinsulin state, and that is why slowly this people suffer from type 2 diabetes mellitus. Obesity also leads to increase in cholesterol levels. So another important complication which is seen is dyslipidemia, increase in lipids level, cholesterol level, increase in LDL level, okay, which slowly leads to deposition of lipids in your blood vessels, leading to atherosclerosis, leading to heart complications like a lot of ischemic heart diseases, increase in blood pressures, okay. So cardiovascular diseases, another complication which is seen in PCOS cases. So there are so many problems which a female with PCOS can suffer. Also, as I said, that this female have increase in androgen levels which could be presented in the form of facial hair growth, severe acne, right, cystic acne, there could be hair fall, specifically male pattern hair fall which could be seen in these females. So this needs to be addressed in a holistic way, right? Talking about homeopathy, now as I mentioned that in this female there is ovulatory dysfunction and ovulation, and in homeopathy there are medicines, okay, particularly which can help in ovulation, regulating this ovulation, which is not happening in PCOS cases, and helping in people or helping couple to conceive in such cases. Also, homeopathy tries to address the root cause of the problem, like for example there could be multiple issues, there could be certain stress which is resulting in PCOS. So homeopathy is very individualistic, and that is why it addresses the root cause and tries to find out and gives a more holistic treatment. Also in this cases lifestyle modification is must, and I feel that should also be very individualistic. Also there is a general dietary guidelines, exercise guideline which needs to be followed, but according to the patient, okay, her needs, requirement, we need to alter the diet, we need to alter the lifestyle which is necessary in these cases. I hope this video was helpful to you all. If you have any questions, do write down in the comment section. If you want to know how homeopathy can help, do write down in the comment section and share the video with more and more people. Till then, stay tuned for my next video. Stay healthy, stay fit. Thank you.